Alright, before we start the skill, we just want to remind you that everything that you learned in 101 is still considered critical, such as verifying the order, gathering the correct supplies, performing hand hygiene before and after performing any client care, knocking on the client's door prior to entering, identifying the client using 2 identifiers, explaining the procedure to the client, providing for their privacy, elevating the bed to promote good body mechanics, donning PPE when indicated, and upon completion of this skill, lowering the bed, applying side rails if needed, and placing the call light within reach. So first thing we're going to do is verify the medical orders and facility policies. Then we're going to explain the procedure to the client. Then we'll gather our equipment. So the first thing we have here is a central line dressing kit. Then we'll have a lure lock. We'll have our needle, or access needle. We'll have a saline flush, a mask for ourselves and the patient. And it's always good to bring an extra set of sterile gloves so you don't have to leave the room if you need to change the gloves. We'll also have a bio patch that we're going to apply with our dressing later on. So once we've got all of our supplies together, we're going to attach the lure lock to the fever needle. We're actually going to prime that with normal saline. Try to keep this as sterile as possible, only touching the very end of the needle. Okay, once we've primed that, we're going to lay it back down, having the flush outside of the sterile packaging and keeping the needle sterile by putting it back in the middle of that packaging. Then we are going to make sure we put a mask on the patient, or have the patient turn his or her head in the opposite direction of the port. We're going to apply clean gloves. And then we're actually going to palpate that implanted port. Once we've done that, we're going to be ready to open our kit. For our patient or us. Get our gloves out. Set those aside. We're going to get our drape out and create our sterile field. Only touching by the 1-inch border. Coming across the table and laying that drape down. Now we're ready to dump our supplies, including the bio patch, onto our sterile field. Once we've done that, we will be ready to apply our sterile gloves. Always good to do hand hygiene between changing your gloves. So we're going to pick that first glove up, back away, and apply that first glove. Then we're coming back for a second glove. we're ready to grab our chlorhexidine. We would then crack that to allow the solution to come out. Then we're going to cleanse the skin and port the chlorhexidine, moving it outward from the port. Once we've allowed that to dry without fanning it, while we're letting that air dry, we're going to come over to our sterile field, pick up our bio patch. We're actually going to put that on the needle after we take the cap off, make it easier to get under that needle. Once we've done that, we're going to stabilize with our non-dominant hand, and we're going to insert that saline prime needle until we hit the back of the port. Once we've hit the back of the port, we're going to aspirate for blood while stabilizing the port to ensure access, and then we're going to flush with saline. Once we've done that and clamped our port, we're going to put a tegaderm on top. We're going to want to initial date, time, and put the gauge of our needle on the tegaderm, and then we're going to document the procedure. And you do want to have the tubing of the needle coming out that little slit on the tegaderm on the bottom there. We want our needle to be in the center of our tegaderm so we can see that side well. Just access the port. For your checkoff, you will be asked to either obtain a blood sample or to administer a medication. So we're going to walk through first obtaining a blood sample from a central venous catheter. So first we're going to gather our equipment. We've got a flush. We want a 10 ml syringe, a blood transfer device, and the tubes we need. So we're going to verify the amount of the specimen that we need. Then we're going to scrub the hub for 30 seconds with an alcohol swab, and we're going to attach a flush. We're going to flush with the full 10 mLs. Once we've done that, we're going to withdraw 10 mLs for waste, which is the saline diluted blood in the same syringe. Then we're going to aspirate blood with a new syringe for the sample, or we can attach this blue vacutainer to the port, and then if we had just attached the blue vacutainer to the port, we would just pop the tubes we needed at that point for the sample. As so. Once we've obtained our blood specimen, we're going to verify the patient identification to label and specimen tube, and then we're going to label a specimen and send it to the lab. Now for med administration, you want to have 2 flushes with you and the medication. You're just going to flush to ensure patency of the CVC, or the central venous catheter. You're going to administer the medication at the prescribed rate. You're going to flush access to ensure all medication is administered. Then we're going to document that, and anytime we access the port, we're going to scrub the hub for at least 30 seconds with an alcohol prep. Now we're ready to walk through de-accessing a port. So first we're going to gather our equipment. So we want to again have a mask on ourselves and the patient, or have them turn their head in the opposite direction. We're going to apply clean gloves. We're going to flush the extension with saline or heparin according to your hospital policy. Then we're going to start to loosen the dressing. This can be done with an alcohol prep, especially if it's really sticking to the patient. The alcohol will help loosen that dressing. Once we've loosened the dressing, we're going to then remove the access while stabilizing the port with our non-dominant hand. We're going to remove the access straight out with the dominant hand and engage the needle guard. Then we're just going to apply dressing if needed. So that can be some 2x2s and tape. Anything that you see that we're using in these videos that is not in your kit will be supplied for you the day of your checkoff. So no worries there. After we've applied our dressing, we'll then document the procedure. Alright, so in this video we're going to show you how to change a central line dressing. Before you do that, you will need to repeat all the things that you did in 101, such as verifying the order, gathering the correct equipment, performing hand hygiene before and after performing any client care, knocking on the client's door prior to entering, identifying the client using 2 identifiers. You're going to explain the procedure to the client and provide for their privacy. You're going to elevate the bed to promote good body mechanics, don PPE when indicated, and upon completion of this skill, you're going to lower the bed, apply side rails if needed, and place the call light within reach. So first thing we're going to do, of course, is verify our order and or facility policy. So most facilities will have a policy in place that state you need to change these dressings at least every 7 days, or anytime they look like they're getting loose or dirty or soiled, and then typically you would also change out the caps on these as well with that dressing change. So once we verify the order and policy, we're going to perform hand hygiene and don PPE as appropriate. So we're going to put on some clean gloves. We're going to identify our patient, name and date of birth while looking at the armband. We're going to provide for privacy and explain the procedure. We're going to assess for iodine and skin allergies prior to this. We're going to position the patient for access to central line insertion points. So if someone has a PICC line, we want that to be below the level of the heart while we're doing this. We're going to put a mask on ourselves, and we're going to either apply a mask to our patient or have them turn their head away from the insertion site. Any patient visitors must wear a mask as well. So now we're ready to set up our sterile field. And you will need so we're going to set up a sterile field where we can either leave the supplies in the sterile kit, or we can use trays if you feel more comfortable with that. But we're going to then add a bio patch to our sterile field and a stabilizing device if indicated. We're going to have clean gloves on or don clean gloves and remove the old dressing and discard. If that dressing is really sticking, you can use some alcohol to loosen that dressing. Once we get that dressing off, we're going to take a good look at our site. We're going to assess the site. after we've gotten that off, we're going to take our gloves off and perform hand hygiene. And put on our sterile gloves. On sterile gloves. Pick that glove up and step back. The first glove. And we're going to come back for our second glove. Once we've got our gloves on, we're going to begin the process of cleaning. So we're going to grab our chlorprep, or chlorhexidine, crack that so the solution comes out, and we're going to cleanse the site from line insertion point in a circular motion outward. We want to use friction in a cross-hatch pattern 2 to 3 inches outward from the insertion point. We need to use a 2x2 to stabilize the catheter for cleaning. That should be in your kit. If not, we'll provide it for you. Once we've cleaned that, we want to clean 3 inches of the central line from the insertion site outward. We can use that sterile gauze to actually pick up that tubing, manipulate that tubing if we need to. So once we've done that, we're going to allow that to air dry completely without fanning it. Then we're going to apply a biopatch over the insertion site. We'll apply a skin protectant if that is our facility policy, as well as a stabilizing device if that is policy. But otherwise, we'll apply a transparent dressing. We want that to be centered over the insertion site. We're going to label the dressing with our date, time, and initials. Then we're going to cleanse the CL caps if appropriate and document the procedure.